Let's face it, medication dosing is one of the challenges of pediatric resuscitation. It's also a common source of anxiety. Let's see if we can bring that anxiety down a little bit. We're going to learn the important pediatric resuscitation doses using 3 techniques: selective memorization, the testing effect, and spaced repetition. When you take care of sick and injured children, you'll sometimes have time to look up medication doses. When you do, that's the safest approach, especially for medications that you don't use very often. But in a resuscitation, there's less time. You have to make patient care decisions, and you don't want to have to look up every medication that you need to give. This is where selective memorization comes in. You'll pick a handful of medications and memorize the doses to decrease your cognitive load during the resuscitation. Many people like to use memory aids for pediatric dosing. They might carry a badge buddy or use a phone app. Having information at your fingertips is important in case you get stuck or need to confirm a dose. Again, we want to make sure that we get that dose right. And memory aids can help you learn doses when you're starting, but looking up every single dose isn't practical, so you need to memorize some. But the key is to not memorize everything. It's what you memorize and how you do it. Think of your brain as a computer for a minute. Your working memory is the RAM, and your long-term memory is the hard drive. Working memory is where you'll keep all the information that you're gathering and processing during the resuscitation, like the history, vital signs, and your physical findings. But working memory has a limited capacity. If you also need to use some of your working memory to hold doses that you're looking up on the fly, it'll fill up quickly. So it's helpful to be able to access important doses from your long-term memory. But our brains are actually much more complex than a computer. We're constantly making, storing, and prioritizing new memories. Unfortunately, that means that long-term memory can fail. So when you're in the process of committing these doses to long-term memory, you'll need to periodically review them. This needs to happen more often initially than less often later. We recommend that you make a table like this, with the medications you think you'll need to have memorized, the weight-based dose, and the usual adult dose. These are the medications that you'll want to know at the bedside without leaving the bedside and without having to look them up every time. Even just the process of choosing will help you remember them. Let's start practicing right now. Pause the video and test yourself with all the weight-based doses. Okay, now let's give them to you. Okay, pause and check them again, then see if you know the adult or max doses. Now check those doses. Okay, here's part 2. Pause now and list all of these weight-based doses. Now check those and do the adult or max doses. And here's the last screen. Same thing here, pause the video and list the doses. Alright, check those and now do the max doses. You can download our worksheet and use it to practice, or even better, make your own list. You might be wondering why you need to know the usual adult or maximum dose. It will be easier if you know the typical dose for an adult-sized patient. It will also help you know which dose to stop at. This will be easier if you have more experience caring for adults and have already memorized those doses. If you're more experienced with children than adults, it will take a little more effort. Also, many pediatric weight-based doses are the adult dose divided by either 50 or 100, since a typical adult weighs between 50 and 100 kilograms. That trick can help you double-check your peds dose. When your list is done, quiz yourself every now and then. That's called spaced repetition. It will help you move the knowledge to long-term memory more effectively, and it will help you beat the forgetting curve. You'll need to practice less often as time goes by. Another way to ensure safe dosing is by teamwork. Create an atmosphere that welcomes feedback, so if you get a dose wrong, someone will catch you. That's good for patient care. Use readbacks like this.
How much epinephrine do I give?
How much does he weigh?
12 kilograms.
1.2 milliliters of 1 to 10,000 epinephrine.
Okay, I'm going to give 1.2 milliliters of 1 to 10,000 epinephrine IV.
Yes.
If you have a pharmacist available to be part of your team, this is one of your best resources. Dedicated pharmacists improve medication safety and timing and help optimize doses. Get to know them and make them feel welcome to provide their input and help. They're lifesavers in more ways than one. So if a little memorization is needed, are there any tricks to help you along the way? Here are a few that we've learned from friends. We've already talked about sliding the decimal for epinephrine dosing for cardiac arrest. That one's nice because it also helps you avoid math. The doses of the 2 most common pediatric sedation agents are the same. Both ketamine and propofol are dosed at 1 to 2 milligrams per kilogram. That helps. Etomidate is popular for rapid sequence intubation. Here's a good trick to help you remember its dose. Rotate the M 90 degrees clockwise, and the middle of the word etomidate turns into its dose, 0.3. Here's another one. Amiodarone has 5 syllables, and the dose is 5 milligrams per kilogram. Feel free to make up your own. When the doses become encoded in your long-term memory, you won't need them anymore. So resuscitation medication dosing is not just a challenge, it's an opportunity for you to inspire confidence in your team that you're familiar with medications for children, that you understand the importance of getting doses right and welcome their input, that you're the right person to be leading this resuscitation. So make that list, stick it to the fridge, and practice every now and then. Next time you have a sick pediatric patient, your long-term memory will be ready for action.